I would now like to introduce our next two speakers, Lucille Esralew and Lauren Libero. I hope I didn't pronounce that wrong. Dr. Esralew is the Senior Supervising Psychologist, Office of Statewide Clinical Services Branch of the California Department of Developmental Services. And Dr. Libero is an Autism Program Specialist at the California Department of Developmental Services.
Good morning, everybody. We're valuing the opportunity to join you this morning and to update you about DDS's California's mental and behavioral health services. So I am Lucy Esralew, and as was said, I am joined by my colleague, Dr. Lauren Libero. So neither Dr. Libero or I have any relevant financial conflicts of interest for today. Based on being with us in this session, we're hoping that you get some of the following information, that you learn about the relatively new category of eligibility for California Regional Center services pertinent to 3- and 4-year-olds, which we term provisional eligibility, that you learn about updates regarding DDS's Safety Net Initiative and related programs, and that you learn about funding opportunities that are related to mental and behavioral health. So just a little bit about our department. DDS is the state agency responsible for overseeing the coordination and provision of services and supports to over 400,000 Californians who have a developmental disability. Services and supports are provided in accordance with the Lanterman Developmental Disability Services Act, and we invite you to visit the website where you will learn about the full array of programs and services that are available through DDS. So a little bit more about where we are situated within the state system. So DDS is part of the California Health and Human Services Agency, which is of course part of the governor's office. And DDS operates what we term state-operated services, which include a secure treatment program at Porterville Developmental Center. We have a community facility and acute crisis homes among the array of state-operated services. So these state-operated facilities provide 24-hour services designed to increase independence, improve living skills, and facilitate transitions into the community. Then DDS contracts with 21 regional centers. So DDS oversees the coordination and delivery of the services for Californians with developmental disabilities through a statewide network of 21 community-based nonprofit agencies, which are known as regional centers. Regional centers provide assessments, they determine eligibility for Lanterman services, they offer case management, which is termed service coordination, and regional centers also develop, purchase, coordinate, and monitor the services in each person's individual program plan, their IPP. Regional centers do that by working in concert with local service providers who in turn provide direct services and supports. The director of DDS, Director Nancy Bargeman. So we are under her leadership. So a little bit more about our services, and that is we are considered a lifespan service provider. And you'll notice that individuals, persons served, enter our system as early as 0 through 2 in federally funded Early Start programming. It's a federal program which is administered through the states. And then ages 3 and 4, there is the possibility of provisional eligibility, which I'll be talking about a little bit more in a few slides. And then the vast majority of the people 5 and older who receive Lanterman services. So just a little bit of a breakdown by category or diagnosis in terms of those who are Lantern ineligible. So most individuals, 53%, are considered, they have an intellectual disorder. 47% are considered to be on the autism spectrum, although that category is growing in size. Epilepsy accounts for about 12% of persons served. Individuals with cerebral palsy constitute about 11% of our population. And then we have category 5 for individuals who have needs for services and supports similar to the individuals with intellectual and developmental disorders, but have not met categories for ID, autism, epilepsy, or cerebral palsy. So I do want to note that an individual may have more than one diagnosis that would make them eligible for Lanterman services. An individual may be on the autism spectrum and also have an intellectual disability, or also have epilepsy or cerebral palsy. So there are any number of possible combinations that may account for duplicate counts in these categories. And in looking at persons served in terms of age, we see that there are about 48,000 individuals who are eligible for early start. That's 0 to 2 years through 2 years old. Most individuals who are Lanterman eligible are under the age of 21. However, we do have the highest single category of individuals ages 22 to 31. And again, this is a lifespan service. Provision of this, and this data was based on July 2022 estimates. So at that point in time, there were about 320 or 30,000 individuals who were Lanterman eligible. We now know that our entire population is now about 400,000. And we know now that for provisional eligibility, as of January 2023, there are about 4,700 children that have been made provisionally eligible for Lanterman. So DDS builds on what works to promote mental and behavioral health of persons served. And by that, I mean, we look to promote the use of evidence-based practices and interventions. We promote local interagency collaboration. We identify and promote standards of care and offer technical assistance and consultation to regional centers. And through that, we emphasize inclusion, diversity, and equity in programs and service settings. So the way that DDS accomplishes all that is by partnering with regional centers and local stakeholders. So here's my opportunity to talk a little bit more about a relatively new category in eligibility, provisional eligibility, which we began in July of 2021. And it is an opportunity to bridge services for those 3 and 4-year-olds who might not meet Lanterman eligibility using standard protocol, but clearly need some continued supports and services. So let's look at that within the continuum of services that are available for eligibility. So early start, as you might know, covers birth to age 36 months. And you have to have a developmental delay that's measured at least 25% in one or more adaptive skills area. And by the way, that is a lowering of the percentage from a previous 33%. So this allows us to serve even more individuals by identifying children who have a 25% delay. And those adaptive skills area include cognition, language, both receptive and expressive language skills, social, emotional, adaptive, or physical and motor development. We also include vision and hearing. There needs to be an established risk, or it could be an established risk condition of known etiology, with a high probability of resulting in delayed development or at high risk of having substantial disability due to a combination of biomedical risk factors which are diagnosed by a qualified professional. For the children that are 3 and 4 years old and might be provisionally eligible, their disability is not solely physical in nature. They have significant functional limitations in at least 2 major areas, life areas: self-care, receptive and expressive language, learning, mobility, self-direction, etc. If you want to get more information, there is an FAQ, which there's a link to in the slide, which will be available to you. So I want to make note of 2 things about provisional eligibility. The child does not need to have a diagnosis of autism, epilepsy, intellectual disability, cerebral palsy. And instead of 3 areas of impairment, they can, it's 2 major life activities that would be delayed or impaired. So for Lanterman eligibility, as you know, it originates prior to age 18 and expected to be lifelong. And there would be 3 areas in which there are functional limitations. So this really gives us an opportunity to expand services. It allows us to bridge from early start to Lanterman eligibility. And regional centers are asked to reassess the child who's made provisionally eligible at least 90 days prior to turning 5 to see if they meet criteria according to standard eligibility protocols. So provisional eligibility is an example of building on what works. Early intervention is an evidence-based approach that helps young children and their families build skills that will increase the likelihood of their success in school and in the community. And the extension of Lanterman eligibility to 3 and 4-year-olds provides benefits to children who meet criteria for early intervention, but may not meet criteria for Lanterman, utilizing the standard protocols that are used to determine eligibility. And again, children are reassessed at age 5 to determine if they then meet Lanterman eligibility on the basis of those standard protocols that include IQ testing, adaptive behavior measures, and getting psychosocial background. At this point, I'd like to turn the presentation over to my colleague, Dr. Lauren Libero.
Thank you. So one of the largest initiatives we have at the department that's focused around mental and behavioral health is our Safety Net initiative. The Safety Net is really the department's commitment to strengthening and developing safety net services that ensure individuals who have developmental disabilities and co-occurring behavioral, mental health, and medical needs are gaining access to an array of services across their lifespan that provide a real continuum of care. And our Safety Net initiative continuum of care includes a number of programs that I'm going to talk about today, ranging from the preventative support services all the way up to acute crisis services. And the development of these services and the Safety Net initiative in general has been strongly informed by our stakeholder groups, which include individuals served by regional centers, their family members, regional center staff, various professionals, and other advocacy groups. And these groups have been providing a lot of feedback to the department to help us develop different strategies to build capacity of our Safety Net workforce, and also identify new models or services that we could develop to help support individuals who need those. And this stakeholder process has resulted in the development of a series of Safety Net plans that the department has published beginning in 2017 And then with our most recent safety net plan, we just published January 10th of this year, 2023. So you can actually access that plan on our website. The link is here on the slide. And the plan includes information not only about the stakeholder process, but also recent investments the department has made, a significant amount of data about individuals with complex support needs, and then the department's plans for the future. So I encourage you to take a look at that plan. A lot of really great information there. So now I'm going to walk you through some examples of our continuum of services. So one major initiative that we have been recently funding is the START model. The START model is a person-centered positive supports program, trauma-informed, for individuals who are served by regional centers who are ages 6 and up. And this is for individuals who may be experiencing crisis, who may be at risk for experiencing crisis, or maybe at risk of losing their current placement in the community. Individuals are referred to the START team from the regional center. And this team provides 24-hour crisis response, very intensive case coordination. There's therapeutic coaching where the START coaches will go to the individual's home, their school, their workplace, wherever education is needed for the individual to learn coping skills, or for their family or staff to learn techniques to help the individual maintain stability. And the START teams are also working to build capacity within their community. They do this through cross-system linkages, where they link with other system partners like hospitals, the county behavioral health, different providers to build capacity and to share the workload. And then they're also doing community education to build expertise among the providers across the state. So this is a relatively new initiative. We began expanding the START model in the state in 2019, and as of this year, we now have 15 teams that are either in operation or will be taking referrals within the next few months. The map on the right here with the colored shaded areas, those are the areas of the state that have a START team. And I know this is maybe a little small for some of you to read the counties, but you can access that map on the Center for START Services website, and the link is here on the slide. Now, another aspect of our safety net continuum is intensive transition services. And these are services for individuals who are moving from very highly restrictive settings back into the community. And this includes people who are at institutions for mental diseases or at our state-operated Porterville Developmental Center Secure Treatment Program. And these services are essentially like wrap service for these individuals. They offer a team that provides risk assessments. They're doing incredibly comprehensive person-centered planning for the individual. They're doing training for the individual, their family, staff members, and supporting the person before the transition happens, during the transition, and then afterwards to make sure that they maintain stability as they move back to the community. Currently, our intensive individualized transition program for individuals stepping out of our secure treatment program is operated by YAI. They're based in the Central Valley area, which is close to Porterville. And then the ITS service for individuals transitioning out of the IMDs or other highly restrictive settings is provided by Amerikey, which is a statewide provider. They have regional offices near Sacramento and then the San Gabriel Pomona Valley area. So those are our ITS services. We also have residential services that we've been developing for a number of years now. And we have two models for these homes that I'm going to tell you about. So we have our community crisis homes, or our CCHs, and then enhanced behavioral support homes, or EBSHs. These are both homes that are in the community within typical neighborhoods. They tend to be, 3 to 5 bed homes. These homes all have comprehensive rate structures, and the individual is going to have a rate that's based on their specific staffing and support needs. So there's a high level of individualization for the people who live in these homes. There's enhanced case coordination and program planning for the individual. So a lot of effort goes into creating a program that really meets all of an individual's needs, not only within the home, but also activities in the community, or if it's a child or adolescent, coordination with the education system, so either public or non-public schools, so that they're receiving their educational programming. And then each individual also has coordinated mental health services as part of their program plan. Now, the main difference between our community crisis homes and our enhanced behavioral supports homes are the enhanced behavior support homes are intended to be a forever home. So an individual would move into one of these with the understanding that they will be there forever or a very long period of time. Whereas our community crisis homes are really meant for individuals who are experiencing a crisis. And these are meant to be time limited. So an individual would stay there about a year or less until they become stabilized and can either return to their previous home or to a new home in the community that's a little less restrictive. And so those are the two main differences between those programs. And currently we have 71 enhanced behavioral support homes across the state, with 43 more homes in development right now. And then we have 28 community crisis homes across the state, with 10 more in development currently. So we've really ramped up the capacity of these homes, and we continue to build them to meet the capacity needs of individuals across the state who need this level of care. We also have a few of those homes that have been specialized for different populations. So previously I mentioned that intensive transition service for individuals either transitioning from an institution for mental disease or the secure treatment program. We also have specialized homes for those populations that serve as a step down into the community. So we have 3 4-bed homes in the Central Valley area for individuals transitioning out of the secure treatment program. And then we have 4 4-bed homes across the state for individuals who are transitioning out of the institutions for mental disease. And these are really meant as a temporary way to step the individual down from that really high level of restrictive care to community care and programming that will make it be more successful for them to then transition back into their home community where they can be fully integrated and safe. Now, we're also developing community crisis homes for children and adolescents. And we currently have 5 of these. They're 4-bed homes. We have them located around Alta California Regional Center, Valley Mountain Regional Center, Westside Regional Center in Los Angeles, San Diego Regional Center, and Regional Center of the East Bay. And these are quite new. They've just come online within the last year or so. And they are serving children and adolescents who are experiencing crisis. Now, I want to mention our work on the system of care. So in 2018, the state passed Assembly Bill 2083, or AB 2083. This is a bill that established statewide requirements to serve youth in foster care who've experienced severe trauma. This bill required the development of memorandums of understanding, or MOUs, for every county in the state. The MOUs were required to integrate practices and care across all of the systems that are involved in caring for youth in foster care. So they were required to establish interagency leadership teams that included child welfare, the regional centers, county offices of education, probation, the county behavioral or mental health, and the federally recognized tribes. And these teams work together to establish processes for information sharing, screening, access to care, child and family teaming, planning for services and supports, working on placements for youth in foster care, among a number of other activities. And that was really one of the main requirements of the bill. But there are a couple of other pieces that I think have also been really incredible to see roll out. So the state has created a state joint interagency resolution team. This is a state level team that provides technical assistance to all of the counties and all of the relevant partners serving youth in foster care. These teams have been working really tirelessly to solve problems and issues and navigate system access for youth all over the state. Our state partners are also doing a systematic gap analysis, looking at the types of placements available for youth, services, and any other issues that need to be resolved at a state level. And they've been developing a really comprehensive multi-year plan to increase capacity to serve this population. So what are we doing within the department around this issue? Well, we have our system of care specialist, Christine Bagley, an incredible champion for foster youth with disabilities. She has been really spearheading this initiative, not only for our department, but also with our other state partners. She's leading the team at our department in this work. And she's helping to coordinate with 15 regional center staff who are also working around the system of care work. These staff all together have been participating in the systems of care technical assistance. They've been working on the development of those MOUs. They're providing support to other regional center staff and providers to make sure that youth with complex needs who are served by child welfare are getting access to all of the services and supports that they need. They've been really working at a state level to think of strategies to improve what we're doing. And one of the really exciting projects that has come out of their work is the development of what we call our dual agency homes. And these are homes for youth who are served by the regional centers and also served by child welfare or are at risk of being served by child welfare. And we're building these dual agency homes under the same model of homes that I just mentioned a couple slides ago. So there will be 2 community crisis homes and 2 enhanced behavioral support homes that are going to be specifically for these children who are regional center served and also child welfare at risk of being served by child welfare. These homes are located in the Regional Center of East Bay and San Diego Regional Center catchment areas. So 1 community crisis home and 1 enhanced behavioral support home in the north, and then the same in the south. But those will be open for youth statewide. So a youth from any regional center who's a foster youth could potentially access those homes if they need that. All right, and then finally, sort of touching on the far end of our continuum is our state-operated STAR program. This is an acute crisis stabilization program that's operated by our department, so state staff. We initially were running STAR out of the developmental centers, but we've been transitioning into homes within the community across the state. So we currently have homes in Vacaville. We have 1 home serving adults 18 and up. We have 1 home serving adolescents, and then a 3rd home unfortunately burned down in a wildfire back in August of 2020. So we have rebuilt that home and we'll be opening it within the next few months to serve children. In the Central Valley area, we have one home open in Springville serving adolescents. We have a second home that's in development in Porterville that will be serving adults. And then down south in Costa Mesa, we have one home serving adolescents and another home serving adults. Now, these are really high-level, person-centered residential services for individuals experiencing severe acute crisis. The ultimate goal is to stabilize the individual and return them back to their long-term community living. And this is a time-limited service, so an individual can stay in the STAR program up to 13 months. So really, the goal is to get back home into a stable environment. Our STAR teams also operate our CAST teams, our Crisis Assessment Stabilization teams. So in our 3 STAR locations, we're also operating CAST. And these are more like mobile crisis services that provide really high level of assessments for individuals. These teams do training and supports for individuals experiencing crisis. They also will train and support family members or staff. And then they also work to connect the individual to services within their home area. And so these services are available to individuals experiencing crisis or who may be at risk of losing their current community living option. And anyone served by a regional center could be referred to this service. So now I'm going to pass it back to Dr. Lucy, who's going to share about one of our main funding opportunities around mental health.
Thank you. So now I'm going to talk about the Mental Health Services Act funding for regional centers, and that is MHSA. And I've given you the website link so that you can, investigate some further. So some background. MHSA was approved by voters in November 2004 to allocate funds to assist counties and state agencies. It's designed to expand and transform California's behavioral health system to better serve individuals with and at risk for serious mental health issues, and also to support their families. So DDS allocates funding through MHSA over 3 fiscal years. And this funding is given to regional centers who partner with local mental health agencies and other stakeholders. There's a total of $740,000 given each fiscal year, and it's to develop and implement innovative projects that support consumers. So we are in cycle 5, but we are about to end cycle 5 and initiate cycle 6. As a matter of fact, proposals are going to be due for cycle 6, 5 o'clock on March 17th. And in partnership with key stakeholders, DDS will then select projects that meet requirements to award projects that in the spring of 2023, and launching these projects in July of 2023 with an end date of June of 2026. So just to give you some examples of the current Cycle 5 MHSA funded projects through DDS, we have peer links through San Diego Regional Center. So in collaboration with NAMI, San Diego Regional Center provides mental health services to consumers age 14 and older with developmental disabilities. It serves Imperial County, and you can see the breakdown in terms of fiscal year of the amount is awarded. The project ends, of course, June 30th of this year. South Central Los Angeles Regional Center has Children's Collaborative Mental Health Project, and in partnership with Kendron Community Mental Health Center, the project provides person-centered mental health assessment and referrals to consumers ages 10 through 17 that are duly diagnosed and are at risk of developing a mental health disorder. It serves South Central Los Angeles, and then you can see the breakdown of the award per fiscal year. Redwood Coast Regional Center is the third of the projects. It's Family and Supports Together, FAST, in collaboration with several local agencies like Easter Seals and North Coast Nurture Center. They target improving social and emotional development in children birth to age 5. And you can see the breakdown of the fiscal years, and it serves Mendocino, Lake Humboldt, and Del Norte counties. So MHSA funding builds on what works. DDS is one of 12 agencies that receives funding through MHSA. Now, the vast majority of the funding, most funding goes to county mental health agencies. However, in terms of the funding that DDS receives, DDS encourages regional centers to develop local capacity to serve individuals with dual diagnoses, that is, individuals with developmental disorders and co-occurring mental health diagnosis, and funds building local capacity with the potential to benefit consumers in the form of enhanced services, technical assistance, training of staff and stakeholders, and promoting interagency collaboration that leads to improved access to mental health services. Another program I want to briefly talk to you about is the American Rescue Plan Act. DDS is currently funding 2 regional center pilot projects through ARPA, which promote family wellness. Far Northern Regional Center and Valley Mountain Regional Center are funded through September 30th to provide their projects. These projects are designed to assist families when their child receives a diagnosis of a developmental disorder, or if the child has been found eligible for early start. And supports include counseling, building networks of peer support, and warm handoffs to applicable resources. The funding is focused on the families of children who are early start eligible or have a known developmental disorder. And this would include services for children with disabilities, but also their parents and their siblings. Unlike other programs, this takes a whole family approach. I want to turn the program back to Dr. Libero to bring us home.
Okay, so quickly, a couple other funding opportunities. The department runs our disparities funds or grants program. This is an $11 million grant program annually given out to regional centers and community-based organizations for projects that are focused on culturally and linguistically responsive services for individuals served through the regional centers. In this most recent cycle, the department was actually awarded an additional $11 million from the state, so $22 million total for our most recent grants program. This isn't a program that's specifically focused on mental health. However, when there's the intersection of mental health and disparities, a project could qualify for these funds. And we actually had 2 recent projects that were funded focusing on mental health access. So this past cycle, East Los Angeles Regional Center was awarded funds for mental health navigation for Chinese and Hispanic families. And then the year before that, there was also a project in the Bay Area with Integrated Community Services that was targeting crisis intervention services for bilingual and bicultural communities. So this is one opportunity that may be of interest to some of you if you have projects that could help to sort of close the service access gap for different groups across the state. And then another opportunity we have is the Children and Youth Behavioral Health Initiative. This is an initiative out of the California Health and Human Services Agency. It's a multi-billion-dollar investment around access to mental and behavioral health for children, adolescents, and young adults in the state. This initiative is going to be vastly increasing access to services for behavioral health through the school systems, as well as a massive online platform that's going to be accessible to children and their families. But this initiative also includes a large number of grants that are going out to increase provider capacity and expertise, as well as expanding the use of evidence-based practices to treat individuals statewide. So the link to this initiative is here on the slide, and I encourage you to take a look at that if you may have projects that could fit those funding streams as well. So I think we're just about out of time here, but thank you for listening as Dr. Lucy and I covered our continuum of services and some of our recent initiatives and funding mechanisms. I think at this time we're opening it up for questions, but I do encourage you to reach out. You can either email Dr. Esralew or myself with any questions or comments after, or you're welcome to email our safety net email address at the department with any broad safety net questions you might have. Thank you.
Well, thank you very much to Dr. Esralew and Dr. Libero for a very timely and comprehensive update. And so what I'm going to do is just lump together some of the questions that people have posed. And so I think there may be a little bit of confusion about the homes that you have described. And my understanding is that specifically these are for mental and behavioral health issues that arise in children and youth who already have a developmental disability.
Yes, so the enhanced behavioral support homes and the community crisis homes, they are for individuals who are eligible for regional center services. So they would have to have a qualifying disability under the Lanterman Act to be referred to one of those homes. They may not necessarily need a mental health diagnosis, to be referred to something like an enhanced behavioral support home. It's really for someone who might have behavioral challenges, not necessarily a mental health diagnosis.
And what happens if that particular client or patient has a medical complexity? Are the homes able to address the same issues in children and youth who may not be medically completely stable?
In some cases, yes. It would be possible to have a nurse who comes to the home to do some attendance of medical needs, but generally they're not meant for individuals who are medically fragile. So for those individuals, we offer our ARF cushions. So these are really highly medically advanced homes with skilled nursing on staff. And I see there's a question about those homes here too. Is there any plan for medically fragile pediatrics patients similar to ARF cushion but for under 18? And actually, yes, our department has been working on a group cushion, which would be a similar model, but for children or adolescents who have complex medical challenges on top of their developmental disabilities. So we're currently in the works to develop those, so stay tuned.
So another question, I think, let's see, one person wrote, since EBSH doesn't provide mental health services, only ABA model, who will serve youth who need that level of care?
That's a good question. These homes should be coordinating mental health services. It may be through the county behavioral health or the individual's health plan. That should be part of their program planning, and the team should be coordinating that care. It may not be the staff in the home, but they should certainly be coordinating that care for the individual.
And I don't want to put both of you in the spot, but if there are issues around access or wait lists or things like that, who can providers or others contact to help things improve?
Yeah, that's a really significant challenge. I think across the state, not even for this population, there are a lot of staffing issues, a lot of capacity issues around our behavioral and mental health system. And we're certainly seeing the strain for providers who can serve people with developmental disabilities. That's a definite challenge, and we see that essentially statewide. So it's a hard question to answer because I know that that's something that's really difficult and has been exacerbated by the pandemic. But I would hope individuals are reaching out to their service coordinators or the regional center clinical team. Those teams should be working to coordinate care. And if there are challenges beyond that, I encourage you to reach out to our department. We have our regional center liaison team and our clinical services team who are happy to hear your concerns and do our best to resolve.
So I think there are just a couple of more questions, and I know we're heading towards lunch break. I think one person had asked about when deciding what level of disability is makes someone eligible for regional center services. When the term substantial disability is used, I suspect that that relates to the 25% disability.
Well, that's for early start is 25%, and for substantial disability for for Lanterman eligibility, it is measured in terms of the use of adaptive behavior scales. So when there's an assessment that's done by a psychologist, as an IQ test is given, if there's a suspicion the person may be on the spectrum. Testing is done in terms of autism, but also adaptive behavior is measured. And according to the tool, that would be, they define significant disability in terms of how somebody performs on an adaptive behavior measure.
So it sounds like there's a standard system for determining that.
Well, there's no specific metric that has been assigned to what we mean by substantial disability. It's really a clinical determination based on the psychologist who's evaluating and the eligibility panel's consideration of all information.
Thank you so very much for an amazing presentation. So much information. I think it will take me days to process this.